Well, initially Jack was, he had gotten attacked. Two dogs pulled him in two different directions by his legs.
So it did some nerve damage. So then eventually what happened was his back legs started to atrophy and he was completely lame and he couldn't walk anymore.
After just some basic medical treatment, he wasn't getting any better, but he was getting worse. The wind would blow him over, he could hardly walk. And it was suggested that we come to Dogwood Vet Hospital for K-laser therapy.
When Jack first came in to see me, I was very concerned because he was showing some significant neurological deficits in his rear legs, particularly the left rear. We did what we call a brief neurological exam, and during that exam we noted that he had what we call a narrow base stance. He would cross over in the rear legs when he walked. He would knuckle over in the rear legs. He was also showing some neurogenic pain to the point of crying out, and that is always considered extremely significant in dogs because they do everything they can to hide their pain, to not show pain, weakness, illness in any way. And so the fact that Jack was showing outward signs of pain by crying out intermittently was very disturbing to us. The next step would have been potentially spinal surgery, MRIs, which is very costly, and in many cases that's not something that's realistic for a lot of people to do. And so we talked about the potential use of K-laser.
I thought, okay, I'll give it a try, because the next stop was euthanasia, because the surgery and MRIs would have been way too expensive for us. And so it was really a last-ditch effort for Jack, and we were just crossing our fingers.
After the first treatment, you could just tell he was starting to feel better. He's very relaxed.
It looked so innocuous to see the treatment, but after the second treatment, he improved so much. The pain went away, and he would begin to be able to walk. I hate to sound corny, but it was like magic. I mean, it was really, it was really that stunning to see it happen.
I will have to say that Jack is a wonderful example of a success story because, again, when he came in, he could barely walk. And after about the second treatment, we were seeing some significant improvements in his mobility, less pain, less crying out.
After the sixth treatment, he was pretty much 100%.
It saved his life. It absolutely saved his life. We were just so pleased because we thought we were going to lose him.
I would really encourage people that are thinking about euthanasia to see if K-laser is right, because it's relatively inexpensive. I mean, it's very affordable.
We use K-laser for a number of things, including hip dysplasia in canines. We use it to speed up healing, reduce inflammation, swelling, pain post-operatively, and have had great success with that as well. We use it, probably the number one use is with neurogenic pain, basically spinal cord issues. The things that I particularly like about the K-laser is that it is non-invasive, it's not painful, it doesn't require sedation, so that it helps minimize the amount of oral medications that a patient may have to manage their pain. I'm Dr. Johnson. I am with Dogwood Veterinary Hospital and Laser Center, and I would just like to ask that if you feel that your pet may be a candidate for K-laser, if your pet is in pain and is not responding to traditional methods of treatment, we would be happy to do a consultation with you and discuss the benefits of K-laser for your pet.